Get started. I appreciate the opportunity to present to you all today. Again, I don't have a formal presentation to provide. I just thought I would kind of pick out some pieces from the application and expound upon it in a way that isn't expounded upon in the application because of space and other issues. But before I do, I feel like I will need to ask if there's a baseline understanding of adverse childhood experiences or ACEs and trauma. Okay, cool. Because if not, I can go through that. But if there is, that's great. That shortens my time. So real quick, since there is a baseline understanding of ACEs and trauma, I wanted to give you guys, ladies, an understanding of how what trauma looks like in certain systems. So in juvenile justice systems, between 75 and 90% of youth who enter the system have experienced some level of traumatic stress and victimization, and actually being abused or neglected actually increases the likelihood of someone entering the juvenile justice system by 59%. We've been collecting ACEs data on our clients at the Family Center for a little over 4 years now, and of course they're adults. Half of them are incarcerated or in substance abuse recovery center. And what we have found is that about 71% of our clients have an ACE score of 4 or more, and over half, about 54%, have a score of 6 or more. Excuse me. And we don't even actually know how many people in the original ACEs study had a score of 6 or more because it was so small that it was negligible to even report. So the purpose of this project is to support the Davidson County Juvenile Court in becoming a fully trauma-informed juvenile court that takes a universal precaution approach. Oh, I just touched something on the keyboard. So a trauma-informed juvenile court that takes a universal precaution approach to trauma that promotes healing, decreases re-traumatization, and mitigates future involvement in the court for youth and families. And then when I say universal precaution approach, that basically, if you think about similar to policies and practices that were enacted in response to the HIV/AIDS epidemic, whereby everyone was assumed to have the disease when blood exposure was a factor. A universal precaution approach to trauma assumes that everyone appearing before the court has some sort of trauma-related history and have experienced adversity. Thus, the factor or the focus becomes ensuring that environments and systems are sensitive to limiting unnecessary arousal, like stress responses and stressors, reflecting an understanding of trauma triggers, like well-designed security procedures and de-escalation tactics, and policies that are designed to help promote healing, like screening and treatment services. And inherent in that approach is that those who do not have a history of trauma will still benefit from the focus of safety and well-being that's instilled in a trauma-informed environment. So if you think about the building of like curb ramps on sidewalks, originally those were built to aid with those with mobility issues, but it actually helps everyone from those who are commuting via bike or skateboards, or even like parents with strollers. So before we start the project, I've already been having conversations with Juvenile Court over the past year about what this might look like for them, because they've kind of invited us to this table. And we've decided that starting in June or July, we're going to form a trauma integration committee. And that committee will receive intensive training on ACEs and brain development, and what a trauma-informed juvenile court looks like in terms of a framework. And they will actually oversee the development and implementation of the project throughout the court. And some people that have already been identified to be part of that committee. We have 2 sets of parents, 2 sets of youth, 2 representatives from MSAC, which is the Metro Student Attendance Center, and then 2 SIA officers, which stands for Support, Intervention, and Accountability. That's their new probation system. And then 1 each for SIA supervisors, assessment specialist, parentage specialist, 1 person from the Foster Care Review Board officer, 1 STAR team representative, a warrant officer, an admin representative, restorative justice employee, a fiscal representative, a community outreach officer, an intake representative. So those people are already kind of been identified and lined up to be part of this trauma integration committee that we're going to convene probably June or July. So the project goal, overarching goal for this is to promote healing and prevent future trauma of youth served by Davidson County Juvenile Court by combating the negative impact of trauma on both youth and staff. Hi. That's it. So again, I'm just going to kind of pull some things from the application that I'm going to expound upon. So one objective of that you'll see in the application is that all court staff will have a deeper understanding of the impact of ACEs and trauma. Currently, most staff have been trained on ACEs, but they have not been trained on the deeper issues of how ACEs alters brain development and how that ultimately impacts future development over time, behavior, and overall functioning. So some of the activities that we're going to do for that is that all staff will complete a comprehensive ACEs survey that's going to include more than the original 10 questions. We're altering our ACEs survey at the Family Center starting April 1st. We're going to include 7 additional questions that address issues like neighborhood violence and bullying, discrimination, and racism, some of the community factors that lead to traumatic experiences, as well as the original 10 that's part of this original survey. And we're going to do that because right now I'm training Davidson County Sheriff's Office employees, and I'm actually getting on ACEs and trauma, and I'm collecting their ACEs data as well, and I'm finding that about 43% of the staff that I'm training have an ACE score of 4 or higher. So we know that the workforce has been impacted by trauma, and that impacts how they show up to work. It impacts how they react and respond to the people in their care. All staff will also complete a professional quality of life scale, and that measures burnout and compassion fatigue. For people who are working in high-stress environments or with people who have histories of trauma. And that speaks to the development and the care of the workforce. The flight attendant on your last flight was right when she says that you have to put on your mask before you can put on someone else's mask, right? And research bears that out. The CDC estimates that about $124 billion is spent over a lifetime related to child maltreatment, and the bulk of that, $83.5 billion, is actually seen in the workforce through reduction in productivity, like absenteeism and turnover, et cetera. So the court has to invest in its own staff as well as in the services that it provides to youth and families. Another objective, is that half of the court divisions will incorporate all 8 essential elements of a trauma-informed juvenile court practices. Some of the activities for that is that, again, the Trauma Integration Committee will develop a trauma integration strategic plan, and that will cover baselines, specific action steps, and personnel responsible for each activity. And much of that model is actually based on a model for achieving breakthrough improvement called the Breakthrough Series Collaborative that was developed by the Institute for Healthcare Improvement. It's designed to help organizations close the gap between what we know and what we do by creating a structure in which the organization learns from each other and from outside experts on a selected topic that they want to improve upon. So key elements of that collaborative include recruiting experts, that would be me, and multidisciplinary participants from the court, and then they develop a framework for change. They convene learning sessions, and in between those learning sessions, they apply the learning in their respective departments in what we call action periods. And those action periods in those action periods, the participants do the whole plan, do, study, and act. And then we come back in for another learning session, evaluate what we've learned, and move forward from there. Another objective is to increase tracking of trauma-related data. This is something that I was actually surprised to learn from Davidson County Court staff, that even though Judge Calloway has made amazing strides in becoming trauma-informed, there's still a lot lacking in terms of how they define things and what data they're collecting and tracking over time. For example, they don't actually have a definition of recidivism, so they're not tracking it in any kind of way either. They're working on that with their probation system review team, but I'll get to that in just a moment, actually. So. Right now, youth who come before the court receive several screenings, including an ACEs and trauma screening, but only some receive a comprehensive assessment, especially if that youth is given an informal adjustment or diversion from court, which is about 80% of the cases that they see, actually. And I'm currently spending time with someone from the assessments division and also someone from their data team to review those policies and procedures that they've developed over the past couple of years. The court is also undergoing a systemic review of their probation services, and that will be completed by May. They'll be getting a final report with findings and recommendations, and the hope is that that work in reforming their probation system and the work of reforming the court to be trauma informed can happen concurrently, and will fold in together. So, and we'll use that to inform our trauma informed work going forward as well. So those are just some of the highlights that I wanted to pull out to expand upon, but I wanted to mostly leave most of the room today just to have a conversation with you all about what you're finding and what questions you may have of us.